Good morning. I'm Dr. Deuk. We're live streaming spine surgery from the Deuk Spine Institute here in Melbourne, Florida. The date today is December 11, 2024. Am I right? Sorry, January 11, 2024. I apologize. We're not quite in December of 24. Our patient is from Texas. She has had neck pain for years. She's here with her lovely husband. They came because she did not want fusion, she did not want metal, she did not want invasive surgery. She didn't want to be laid up, have the risk of complications. What's the complication rate for cervical fusion? ACDF, most common surgery done for a disc problem in the neck, complication rate is 48%. Basically 50% of patients have complications. That is unacceptable and very high. Deuk laser disc repair cervical, we have a complication rate of 0. So we've done thousands of these surgeries now. It's extremely safe for the patient. The recovery is just a few hours, and the next day the patient could go back to work, drive, shop, all kinds of normal activities with some minor restrictions. All right. Were you stimulating her?
Yeah, I was just double checking.
You can see he's stimulating her muscles. Where are we at on twitches?
I just gave a little more.
All right, let me see where we are. The neck must be supple. Our patient is intubated. They have a tube down, and they're asleep. And I want them completely relaxed. That makes my job not easier, but safer for the patient. 2, 3, 4, 5, 6, 7. We're going to be doing a left approach, C5-6, C6-7. On the x-ray, there's a bone spur at 5-6. There's a herniation at 6-7. There's also a herniation at 5-6. So let me see. We're going to have to place our needle. The neck is a little tight, could be more supple. Should I wait? I'm going to wait a second. The reason why we want the muscles relaxed in the neck, because there's muscles in the front of the neck, there's muscles in the back of the neck. We're more interested in the muscles in the front of the neck for this type of surgery. If the muscles are tight, then when I push here, they'll tighten up, and it's hard for me then to do what I need to do. So we want the muscles completely relaxed. The patient's face is here, she's looking up. Her chest is here, body is down this way. This is the front of her neck, her Adam's apple is there. This is the right side of her neck. All right, so Henry, if you'd like, you can show our audience a video of why do disc injuries like herniated disc, degenerated disc, why do they cause neck pain? Welcome back. Now you understand how disc injuries, particularly annular tears, how do they cause so much pain and symptoms? It has to do with inflammation. AP, Coker? At this point, we've managed to place the needle into the disc at 2, 3, 4, 5, 6, 7. Shot. Perfect. You see it's in the middle. Show us the middle there. Uh-huh. And the needle is just inside the disc, starting to head to the left foramen. So it's perfect positioning on the AP view. And let's go to a lateral view. Our patient, by the way, has a wonderful neck. She's so thoughtful. There we go. So we're going to do our discogram. I'm going to show you, take a look at the back of the disc right now. Jordan, show us the back of the disc. You can see that's where the tear will be that you guys just saw on the video. The video showed you a tear in the back of the disc. We're going to show you that tear right now. The dye will allow me to see it. Shot? Yep, there it is. Perfect. Keep that picture. Henry, I want that picture for the website right there.
Copy that.
And Jordan, keep your arrow right there. Henry, Jordan, go up a little bit higher with the arrow, just a smidgen. There you go. Henry, right there. That shot right there is textbook perfect. Will you take that shot, give it to Sanjay? I want it on the website.
Copy
For the
that.
cervical Deuk laser disc repair.
Copy that.
Okay, thank you. That tear is exactly where all of her pain and symptoms are coming from. And she has such a nice neck. We have such a nice view that I really want to preserve it. And I want to keep it for others to learn. You can actually see the herniation outlined. Show us the herniation, Jordan. It's right there. You guys see the dye behind the herniation? It makes like a little mountain sideways. That is the herniation at 6, 7. Let's count the bones. 2, 3, 4, 5, 6, 7. We're doing 5, 6, 6, 7. Everyone agrees? So this surgery replaces anterior cervical discectomy and fusion, as well as artificial disc replacement. This is a better surgery than those two. I've performed over 1,000 ACDFs and artificial discs in my career. They are highly invasive surgeries and totally unnecessary when you can do the laser surgery. All right. So we're going to make a 4 millimeter incision. 4 millimeters. Let's get a tape measure. When you're doing an ACDF, you're going to make a huge incision. It's going to be a couple of inches. All right? And an ACDF is going to be about 2 inches. It's a huge incision from here to here. But with our surgery, we're going to make a 4 millimeter incision. You guys see this?
Yes, we do.
Hold it there.
Perfect.
Push it down, yeah. We're going to make a 4 millimeter incision. That's all that's necessary to fix this woman's neck. Okay, and I think that's about 4 millimeters right there. So let's see if we can't get it done with that incision. Remember, this replaces an ACDF. It replaces artificial disc surgery. Hey, send this one to me for Jeff Deverett. Okay?
Copy that.
Send the surgery to me on email as a link when it's done so I can send it to Jeff.
Copy that.
He can send it to his surgeon friend he plays golf with, Shot, who doesn't know anything about it. Shot? All right, so I'm trying to get the needle out at this point, and once I get this needle out, Shot, I'm leaving in the guide wire. The guide wire will guide the next tool. The next tool is the dilator. You guys see this here?
Yes, we do.
Notice how the tip is tapered. Okay, this is going to slide down the guide wire, and it's going to gently separate tissues. Gently separate tissues. We're not cutting anything. The only thing that's cut is the skin. And you can all see the skin incision is 4 millimeters. It's tiny. Okay? Shot? You see that right there, Henry? Okay?
Yes, we do.
So I'm going to bring the dilator down all the way to the spine. Shot? Now, she and her husband are from Texas. And in Texas, they only do fusions and artificial discs. She didn't want either. She doesn't want metal in her neck. But all these spine surgeons, all they want to do is put metal in people's neck because that's where you make the most money. When I was doing metal surgeries like fusions and artificial discs, I made a lot more money than I make on these laser surgeries. You can see the tip of the dilator is in the middle of the spine. That's perfect. Jordan, show us real quick with your arrow. I know it's a little blurry. Henry, go to the x-ray there. You could see the tip of the dilator right there at the front of the disc in the middle of the spine, which is perfect. Then you could see the guide wire going into the disc. It's going to slide down that. You can also see the endotracheal tube. You can see the esophageal temperature probe. You can see the dye leaking out in the foramen on the right side, right there. Yeah, no, go to the right. Yeah, that's the right side. See that right there? There's the tear. Show the herniation. Just past the tear. There it is. You guys see that little curve right there, the black curve right there where the arrow is?
Yes, we do.
That's the herniation. So, this is the most advanced spine surgery in the world for a disc herniation or disc bulge or degenerated disc. And unfortunately, a lot of spine surgeons don't know it even exists. They don't want to know because the information is being kept from them by their societies, by third parties that want surgeons to keep doing fusions and artificial discs. So the American Association of Neurological Surgeons, the American Orthopedic Association, all of these big educational societies that are supposed to be teaching our surgeons the newest, most advanced treatment are keeping this from them because they're being controlled now by the implant companies. The educational agenda is completely controlled by implant companies. They donate all the money to the meetings that we go to every year for our education. They pay millions and millions of dollars, usually around 10 to 25, 30, 40 million. And that's the money that these companies get, these educational companies get, like the American Association of Neurological Surgeons gets most of its funding from corporations that profit off of devices that are being put into patients. And that's what medicine has become. They call it technological advances, but it's not. It's a lie. This surgery you're watching uses 0 devices. We're not implanting anything. No metal, no plastic, no cadaver bone, no synthetic bone, nothing. We're actually all natural, going to go in and remove the herniation with a laser. We're going to repair the tear so that the body can heal it properly. We're going to get rid of her symptoms with this simple surgery. There are no implants. Therefore, the companies that sell implants, they don't want doctors doing this surgery because they're going to go out of business. So they control the spine surgeons. They take them out to steak dinners. They take them out to meetings in Hawaii, pay for their hotels, pay for all kinds of illegal activities where they're getting bribed to continue to put metal in patients and recommend metal. And we want people to know the truth. That's why we broadcast, so people can learn the truth. The truth is, you guys are being scammed. This is the best, yet your spine surgeon won't tell you about it. They'll downplay it and say it doesn't work, yet they don't know anything about the procedure. This surgery has been peer-reviewed and published multiple times, over 10 times, in the medical literature. And yet, they don't want you to have this done because they're not making a lot of money off of it. All right, here we go. So that's good. You could see here at the bottom of the tube, that's where the herniation is. And I'm going to use the laser now. This is a 0.5 millimeter, 0.5 millimeter fiber. You can see, just for sizing, that's the herniation right there, the blue stuff. It's about to come out. Here's a piece. And it's not one herniation. There's a piece right there. You guys see that, Henry?
Yes, we do.
That piece of herniation is one of many. This patient probably has at least 10 pieces of herniation right here at the back of the disc. So when you talk about a herniated disc, we're not talking about one herniation, one piece. We're talking about many. That's one thing we discovered by doing endoscopic surgery. Inside the disc, we've seen all the herniations, and it's more than one. When you don't do endoscopic surgery, you do ACDFs or artificial discs, you can't see all the pieces of herniation. You don't have the resolution to do it, the magnification, the illumination, okay? All right, that's going to be her right C5-C7 foramen, and we're going to clean it up. There's another piece of herniation. That makes at least two. I've vaporized a few. There's three right there. Look at that piece. That's three, right? And they're coming and floating up the tube, floating out. Man, that is cold irrigation. That's fine. We want cold. Cold keeps the laser and the tissues cool. All right. Questions for me?
Yes, we have a couple questions. This first one comes from And Justice for All on YouTube,
Yep. Hi, Justice for All. Nice to have you back.
asking, good morning, Dr.
Oh, look at that
Deuk.
herniation right there. Woo! That's a big one. That's a big one. Now, who invented this technique of putting a tube in, and I'll take your question in a minute, putting a tube in through the disc to remove a herniation? It was not me. It was the Koreans, specifically Dr. Sang-Ho Lee, who trained me personally, along with Dr. Gun Choi, his first assistant, right-hand man. Look at the herniation. Can you guys see this?
Yes, we do.
All right, let's get a tape measure here. That's just one of many. You guys see it right there?
Yes, we do.
All right, let me put it on the tape measure. How big is that? See, it's perfect. That is 1, 2, 3, 4, 5 millimeters by 5 millimeters. Now look carefully here. Can you see this, Henry?
Yes, we do.
You see how there's blue? The blue is the blue dye we use, the Deuk spine dye, to stain degenerated herniated disc. It only stains to degenerated nucleus pulposus. Look right here. You see that pinkish color stuff?
Yes, we do.
That's inflammation. That's the body attacking this piece of herniation, trying to get rid of it. And that's where her pain's coming from, that inflammation right there. You do see the color, right? The pinkish color?
Yes, we do.
It's perfect. This is the most advanced knowledge right now in spine surgery, and yet 99.9% of spine surgeons choose to ignore it completely because they don't want it to become a reality. You see, if you ignore things, often it can become, it stays out of the reality realm. You understand what I'm saying? Right? If you have termites eating your house and you find out and you just choose to ignore it, then you don't have to deal with it, right? For a long time. You can let somebody else deal with it. That's what they're doing. And meanwhile, patients are suffering. Here's another herniation right there. So far, we've seen about 6 or 7 pieces. Notice how they're all about the same size. They're small. Each one is around 5 millimeters in the cervical spine. You don't get big herniations in the cervical spine. You get small ones. This one I had to cut. There's another piece. And I will take the questions from And Justice for All.
This question from And Justice for All on YouTube, asking, good morning, Dr. Deuk. Good
Morning.
to see you back. I know that you prefer the inside-out technique. My question is, when exactly and how do you push the pathology inside the disc and then clean it?
Great question. So, And Justice for All, the inside-out technique is for lumbar, where you're going, starting in the foramen where the herniation is, and you're pushing it in with the dilator. And then you're pushing it in more when you put the tube in. By the way, this is a bone spur right here that I'm removing with the laser, okay? There's another one there. And I'm removing these because they're right where the nerve is, and I want to get rid of them. Apologize for the piece of herniation still in our view. Let's go get rid of that. So the inside-out technique is where you start with your laser and your dissection, and debulking starts inside the disc. I use it in the lumbar, I use it in the cervical. We're doing it right now. We're starting inside where the herniation base is, and we are going to move to the epidural space right now. That is the fibers right there of what's called the posterior longitudinal ligament. So it's a little different for the cervical spine than it is for the lumbar. but the concept is the same. You're starting in a safe place, which is inside the disc. There's really not much you can harm inside the disc. You can't really harm anything. Outside the disc is where you find the spinal cord and the nerve roots and blood vessels. You want to stay away from those things. You want to avoid them. So by starting inside the disc, you avoid damaging those structures inadvertently, accidentally. Okay? These are fibers of the PLL, posterior longitudinal ligament. Jeff Deverett, show this to your buddy. He has never seen this in his life, I guarantee it. He'll probably have a sphincter loosening event watching it. But he's going to get blown away. Okay? What he calls a hoax, a scam, fake, expected response from somebody like him. But you can see the fibers of the posterior ligament right there running up and down. To the right is the end plate of C6, and to the left is the end plate of C7. C6, C7. So we're at the back of the C6-7 disc where the herniation is, and we're removing the herniation from the back of the disc without removing the disc. Okay, and that's what makes this procedure different. Again, pioneered by the Koreans, the South Koreans. Brilliant. Dr. Sang-Ho Lee. Okay, and the reason why it's brilliant is that every other spine surgeon, to get to a herniation in the back of the disc, has to first remove the disc to get there. But not anymore, not with endoscopic surgery. We can go through the normal disc and pass through it like a ninja and get to the back where the actual problem is and fix just the problem and not remove the disc while you're doing it. Here's another piece of herniation. Having to cut that one right there, okay? But you see how effective the laser is. There is no other tool in surgery that will remove this herniation so precisely. And just to give you an idea, that glass fiber right there is 0.5 millimeter, 0.5 millimeters. Your friend, the orthopedic surgeon, I believe, or whatever he is, probably can't even see something that's 0.5 millimeter with his vision. I would guess. Unless he's used to looking at small things. Oh, look at that. Another piece of herniation. So far we've seen, I don't know. How many pieces of herniation, Henry? 10, 12?
Good amount, yeah.
Huh?
I would say a good amount, yeah.
Yeah, 12 at least. 12 pieces of herniation at the back of this disc. Look at how beautiful this is. 0.5 millimeter. Look how precise the laser is. There's no tool, Jeff, that's ever been in your buddy's hand that has 0.5 millimeter precision. Okay? Everything he uses has a precision of about 2 centimeters. So, my God, what is that? 2 centimeters. That's 40 times less precise. He has no idea how to do precise surgery like this. Okay? This is the most precise surgery in the world. And here's why. Not only is that glass tube 0.5 millimeter, but I can control the laser up to 1/10 of a millimeter. 1/10. 0.1 millimeter. That's how much precision I have. There is no surgical tool used in an ACDF, a laminectomy, a foraminotomy that has 0.1 millimeter precision. So you read about this stuff online, all these people bashing laser spine surgery. Well, I don't agree with laser spine surgery, but the Deuk laser disc repair, what we're doing right now, is the most precise surgery in the world. Every one of those blasts you're seeing is 0.1 millimeter precision, 0.1. And I'm right on top of the spinal cord, by the way. That spinal cord is just right there. So you can work right on top of the spinal cord. You can see what you're doing with endoscopic Deuk laser disc repair.
We have a couple more questions.
Yeah, no problem.
This next question comes from Tracy on Facebook,
Yep.
saying, asking, for your patients that have numbness in their fingers, approximately what percentage of them regain full or close to full feeling after the cervical DLDR? For those that do regain feeling, what might be the average time frame?
Hi, Tracy. Great question. So, first question you want to know is, what's causing the numbness in the fingers? Because the cervical Deuk laser disc repair only fixes pinched nerve in the neck, called nerve root, or pinched spinal cord. It doesn't fix other causes of numbness, like carpal tunnel syndrome, or ulnar neuropathy, or diabetic neuropathy. All those other causes of numbness in the finger have nothing to do with the neck. And if you're asking, okay, I've got numbness in my finger, going to have the cervical Deuk laser disc repair, is my numbness going to go away? The first question is, where's it coming from? Look at all these herniations. If your numbness is coming from the pinched nerves in your neck, then you can expect to wait anywhere between 1 day and 1 year to get rid of the numbness. And the reason I give you that range is because it really is a range. Everybody's different. Some people it goes away immediately, like right after surgery. They can feel it go away in the recovery room. I've heard them say that many times. Other people say the numbness will take 6 months to a year to go away. So I think if your numbness is due to the pinched nerve in your neck or pinched spinal cord, it could be 1 day to 1 year is what I would say. The average, probably somewhere around 3 months. Great question. Let's show our video, Henry, on how does the Deuk laser disc repair work? What are we actually doing here? All right, welcome back. You see now how the Deuk laser disc repair procedure works. We're going in with an endoscope, finding the tear, and we're removing the herniation. That's the blue stuff right here. That is the herniation right there. You see how easily the laser removes it. Every blast removes 0.1 millimeter thick. That's how precise this tool is. There is no tool in medicine more precise than 0.1 millimeter in surgery. I promise you. Of course, there's medications that work at a molecular level. We're not talking about that. We're talking about surgery. There's no scalpel, no surgical tool that any spine surgeon or orthopedic surgeon or neurosurgeon has that is more precise than this laser you're seeing right now. This is 100 times more precise. Okay, so the doctors will lie to you because they don't do the surgery. They'll tell you it's dangerous. They're lying to you because they don't want to lose your business. And they're lying to you because they're lying to themselves. They have egos, and they don't like to know that somebody else out there has actually outdone them. Surgeons are very competitive people. You know, if you remember back in school, they're the students that basically studied all the time to get A's. So they don't study to get A's, they study so they can do better than you. And they're very competitive, they're egocentric, and for the most part, they're just not good people, in my opinion, okay? Yep. And that's based on many years of dealing with them, personally, professionally. Some of you don't know, but I was the chief of staff of a hospital for several years, so I dealt with a lot of surgeons and a lot of doctors. And I don't have anything against surgeons. I have things against bad people. There's another herniation right there. People that lie, cheat, and steal. especially patients. All right, so we've taken out about 25 pieces of herniation, and we're just about done. And look at that, how amazing that is. I've gotten rid of bone spurs, I've gotten rid of herniation, I've gotten rid of scar tissue. This patient's going to do fantastic. Look at that piece of inflammation right there. See it? That red color right there? That's all that's left. Can't get any more than that. All right, other questions?
This next question comes from Injustice for All once
Another
more.
herniation right there. See it floating up? So we're floating it right out of the tube. Sorry. And Justice for All, I will get to your questions. I think we're just about done with the first disc. Go ahead, Henry.
And Justice for All once more on YouTube asks, Dr. Deuk, what do you think about the use of chymopapine after a endoscopic disc surgery?
Yeah, totally unnecessary, very dangerous. I would not use chymopapine after my surgery. I do not recommend chymopapine. Chymopapine was very popular at one point, and it was taken off of the market by the FDA. It was made illegal for a reason. Patients were getting what's called transverse myelitis. They were basically going paralyzed from the drug. It was being injected by pain management doctors into the disc. And the problem was it was leaking out the back, and it was pushing on, getting onto the spinal cord, and it was causing an inflammation within the spinal cord we call transverse myelitis. Okay, very bad, very, very bad. And people were going paralyzed, by the way. And so I don't agree with it. By the way, that's a bone spur right there. We just took a bone spur out of the foramen on the right at C5-C7. Yeah, chymopapine is illegal in the United States. You cannot do it. I would not recommend it at all. It's too dangerous, and it's totally unnecessary.
I think it's done in Mexico.
This surgery right here is all you need. You don't need any drugs. You don't need any implants. The bone spur is gone. Henry, I want you to capture this segment we just did for the last 3 minutes. I just removed a really nice bone spur, which I do a lot, but the point is you could see it very nicely being removed. And there's the nerve right there. That is the this is 6-7, so that's the C7 nerve root right there. Totally decompressed. Can you keep that, please? That's the last couple of minutes as bone spur removal with laser. And I
Copy.
want to put that on the website.
Copy that.
Send that to Sanjay. Perfect. Done. Beautiful. We're done here. I don't see any more herniation. So one disc down. Jeff, share this with your buddy. Tell him to spend less time on the golf course and more time studying new technology so he can take better care of his patients and stop lying to them. And please don't edit my voice out because I want to make sure he hears that.
Copy that.
Make sure this video gets to Jeff Deverett. Do you have his email?
No, I was going to just email it to you.
Yeah, that's fine. All right, one disc down. Look at the incision, guys and gals. 4 millimeter incision. Incredible, huh? We're almost done. We got one more to go. Here's for your buddy, Jeff. 4 millimeters. All right, what other questions do we have?
This next question comes from Vivian on Facebook.
Hello, Vivian. How are you? By the way, you get more bleeding when you take bone spurs out because the bone spur actually has cortical bone and it has diploic bone. And the diploic bone is where red blood cells are made. So by going in and removing the bone spur, you're making a little more bleeding. It's nothing to worry about. This is minimal to no bleeding. This is like less than if you have a tooth pulled. Go ahead.
They asked, will insurance cover this like Cigna? We are from Texas. My husband has cervical and lumbar problems. He is getting injections every year.
So the answer is yes, we expect Cigna to pay for the surgery, Aetna, Blue Cross. And we've gotten payments from Cigna, Aetna, Blue Cross, United. We've gotten payments from all the insurance companies except Medicare and Medicaid. I do not expect them to pay. However, it's going to be a fight with the insurance companies. We have to appeal often and send letters and explaining the surgery and why they have to cover it. So I'm not going to sit here, Shot, and guarantee you 100% they're going to pay. Because the problem with insurance companies, you don't know if they're going to pay until after you treat the patient. And then you find out whether they're going to pay or not, and you have to fight them. So we expect Cigna to pay, Shot, and we don't have a contract with Cigna to pay, but if your insurance has benefits out of network, it should cover it. Even if you don't have out of network benefits, it should cover it because you can't get this done in Texas. So you really need to come here and go here to get it done. The other thing we can do is a single case agreement where we make a contract with Cigna for one surgery. But yes, we expect Cigna to pay. Doesn't mean they will. Insurance companies always try to get out of paying the bill. Okay, 2, 3, 4, 5, 6, 7. 2, 3, 4, 5, 6, 7. We're done with 6, 7. We're going to move up to 5, 6. Let me just see. Okay, I'm going to be moving the dilator out of the disc. Shot. I'm going to move it up to the next disc. And there's a way to do this, and it has to be done very carefully. This is truly, in my opinion, the hardest part of the entire surgery. And it takes the most skill and concentration. So let me just focus for a minute. Okay, good. I'm out. Shot. All right, now I've got to stay in the middle as I move up to the next disc. Now this technique you're watching right now was developed here at Deuk Spine by me. I'm the pioneer. It's called the Deuk Spine Shuffle or slide for those of you that can't shuffle. And we're basically sliding the tip of the dilator up the PLL. AP? I want to stay in the middle as much as possible. Perfect. Lateral. And what I'm sliding up is what's called the anterior longitudinal ligament. It's a smooth surface that is very slick, and it's surrounded by 2 mountain ranges, what are called the longus colli muscles. That's it right there? Perfect. So I want to go up just a little more. There's a little bit of a bone spur. I'm going to hop up that little bone right there. Good. I'm there. Perfect. A little bit higher. Shot. All right. I'm happy with that. Let's get an AP. You always want to check front, back, side views, 2 views to make sure you're in the right place. Again, this slide from one disc to the next was developed at Deuk Spine by me, and it is the first time it's ever been done in the world. It was done here at Deuk Spine. The Koreans never did 2 levels at a time. Back in the day, they did 1 level. That's perfect. And they never had to slide. Any other questions?
Yes. Well, I believe this is a bit of a just comedy. Comes from David on YouTube saying, I sent an email to Dr. Kim at University of Minnesota, the head of spine surgery. I shared one of your videos with him. I can't afford your surgery and asked him
AP.
if he wanted to use a guinea pig. He wanted to use me as a guinea pig, and I haven't heard back.
Interesting. Well, listen, David, was it David?
David, yep.
David, I'm talking to you. You can afford this surgery, okay? You can. As a matter of fact, you cannot afford not to have the surgery. If you think about all the complications that happen to patients with other types of surgery and other surgeons, you ruin your life with a surgical complication. You don't want that. You want something that's going to work and it's safe. And we've done now 1,000, basically almost 1,900 of these surgeries. Shot? And so we've not had a single complication on the cervicals at all. The complication rate is less than 1 in 1,000, I can tell you that. If you have other types of surgery, the complication rate goes up to as high as 50%. There's the tear. Look at that thing. That's really cool. Henry, get this one too for the website.
Copy that.
You guys see the tear, the black line? That's the dye leaking out through the tear in the back of the annulus to the herniation in the back. All right. Save that one as well. Take pictures. Give it to Sanjay and I. I love it. We're making some really nice pictures for our new website.
Copy
Anyway,
that.
David, I don't mean to sound callous. Believe me, I'm not. But prioritize your neck. You see, what people don't understand is that not all treatments are equal. So you may be thinking, well, I can't do this, but I'll do a fusion, and I'll have the same result. You're not going to have the same result. That's the whole point. Fusion has complications. It causes stiffness. It causes adjacent segment disease. It causes all kinds of health issues afterwards. And the doctors do it because, well, they make a lot of money doing fusions, okay? And they do it because they don't expect you to get out of pain anyway with their surgery. We expect to get rid of your pain. That's what we do. We have a variety of treatments for different causes. There are 30 causes of neck pain. These 2 discs are just 2 out of 30. There are another 28 causes. Shot? So our goal here at Deuk Spine is to get rid of your pain. And we can do that if we can treat all the causes. So my advice to you, David, avoid bad surgery, avoid complications, avoid ruining your life. Get a safe, good surgery done. I wouldn't trust Dr. Kim to do a surgery he's never done before without proper training. I personally would not do a surgery I've never done before without proper training. You're putting the patient's life at risk. Okay, so this disc is more collapsed than the last one. It's more degenerated, more scarred. I do need inline, Berndes. And let's give it a little shoulder pull. We're going to try to distract the disc a little bit, just gently. Let me know when you guys are ready. We're going to pull the bones apart slightly so that I could try to get this in. Yep. You feel it, huh? Yeah, Dr. Berndes feels these moving. That's how sensitive his hands are. Luis, you keep an eye on that tip. That's all I care about. I'm looking at it too, but... All right, we're moving basically a millimeter or 2 at a time. All right, guys, one more effort here, one more push, and we'll be done, okay? Ready? Shot? Here we go. Just the last few millimeters. Shot. That felt pretty good. One more. All right, that's it. That's as much as I can do safely. Great job, everybody. So you got to be able to have a strategy in place, ready to go for challenges you get in the operating room, because not everybody's the same. And this disc was more scarred together, so the bones would not separate as easily when I was putting the dilator and tube in, so we had to help the patient a little. Questions?
Yes, next question comes from Vivian once more on Facebook, saying, can you tell us before, talking about her husband with the cervical and lumbar problems, that's
Yep.
fine, but could you tell us beforehand of what we can expect?
Oh, yeah. So great question. I should have said something. I'm just so used to answering these questions 1,000 times. But what you're asking is, can we know what our out-of-pocket will be before the surgeries? The answer is yes, always. When we have people come here, we do what's called an MRI review, where I will meet with the patients by Zoom. I'll review their films, and we'll work out what needs to be done. You're always going to know the cost out-of-pocket maximum for you before surgery. We don't just bring people here, do surgery, and surprise them with a bill, ever. The only time you're going to get a surprise is if you have another problem we didn't know about, and we find it when you get here, and it wasn't discovered. Oh, look at this herniation right here. Oh, yeah. You know, for example, this patient right here that we're doing surgery on, they had to pay out of pocket, cash, a copay, or a what's called an out-of-pocket amount, a certain amount that they have to pay for the surgery. They knew what it was before they even accepted the surgery. So we tell people what they're going to owe ahead of time. And then we bill their insurance. Now, if the insurance picks up 100% of the bill, we give people a refund of whatever they paid if they overpaid for some reason. That's our standard practice, okay? All right, so far everything is going well. You can see this disc is definitely more degenerated. Look at that herniation right there. Very nice. And I've got 10 minutes, doctor. I'm telling my anesthesiologist how much time I have left so he can adjust the amount of anesthesia gas the patient's getting, and so the patient can wake up when we're done. Otherwise, you know, when you have a bad anesthesiologist, the patient may stay asleep for an hour after the surgery. And I don't. Yeah, we've had anesthesiologists in the past where that happened, and it's not good for the patient because the patient's laying there with a tube for an extra hour against their voice box, or they're, you know, getting fluids for another hour. So it's just bad. So good anesthesiologists can time the surgery to, you know, for the patient to kind of wake up close to when the surgery finishes. Any questions?
Next is a comment from David, once more on YouTube,
Yeah.
saying that he had a consultation with us and couldn't come up with the funds, but he does admire your work, by the way.
Thank you, David. Thank you. Very kind of you, David. I really hope you can come up with the funds because I don't want to see you get bad surgery and I don't want to see you live in pain. You know, and I'll be honest with you, David. I don't remember what your insurance was, but we're hoping that Blue Cross will be contracted on this soon. Look at the size of that herniation. You guys see where it's coming out of? It's coming out of the foramen. That's the neural foramen, right side C5-C7. Look at the size of this herniation. It's huge. I'm going to try to grab it and pull it out, but I don't know if I can because, well, the tube is kind of, you know, it's only, the tube is only 2.8 millimeters wide on the inside. Nope, didn't get it. Now, if I can't get it, that doesn't mean all hope is lost. It just means I got to go in and laser it, because the laser will chop it in half, and then I can get it out. Okay? Hey, Henry, that's actually a really good picture, though. Oh, I don't know if you can go back and save that one, too. That's a herniation.
I could try.
Right there coming out of the foramen. So I'm going to cut it in half. It's called bivalve. It's a surgical term. We bivalve it, and now we can float it out. You guys see that? Pretty damn cool, huh? I'm telling you, this is the most amazing surgery in the world. Look at the size of that herniation. It just slipped out. It was sitting on top of the nerve root. Jeff, show this right here to your buddy and tell him if he doesn't understand it, I can talk to him and explain it. Happy to do that. Or I can have one of our YouTube, you know, viewers do that. Like, and Justice for All. Look at the size of the herniation. Remember, this was cut in half. Can you see this, Henry?
Yes, we can.
Yeah. And it's kind of bloody because we've been chopping bone spurs too. But there it is. And it was double that size earlier before I cut it. Yeah, tell your orthopedic or neurosurgery friend that if they need an explanation of what we're doing, that I could have one of our YouTube fans explain it to him, because they actually probably know more about it than he does. All right, there's the tear in the annulus. Oh, there's another herniation, just came out, sitting on top of the nerve. Look at all the herniations, folks. Look how easy they come out with the endoscopic Deuk laser disc repair. You can't do it without a laser, by the way. It is impossible. And we're the only ones that do this. Nobody else in the world. This is the best. I really hope David can somehow come up with the funds. You know, Dave, I don't know who your scheduler was, but maybe you should talk to him. Sometimes we have patients that are generous and are willing to make some donations. I don't know. You know, oh, look at that herniation just came out. Oh, beautiful. Oh, I love it. Nothing makes me happier than watching a herniation come out of the back of the disc where the nerve is, unpinching the nerve root. She's going to feel wonderful after she heals up. Now, everybody that has this surgery has pain, right after the surgery. Like if you talk to them in the recovery area, they're going to say my neck hurts. Yeah, because we were back there with a laser zapping away bone spurs and herniations, right? So we expect it, but it always goes away. Oh, another one by the next morning. How many pieces have we taken out? Has anybody kept track? Look at how fluffy the edges are. You guys see that? Kind of like soft and flippy in the water. That means that this has not been scarred up much, okay? So that's a new herniation. It's relatively new, like probably just a few months old. Not like super long, like a year old or anything. That's a new one. All right, just about done. 5 minutes. I got to go check the other side. There's the foramen where the nerve lives. We're going to go across to the other side and take a quick peek. Any more questions? If you have them, type them up. I will answer them for you. Okay?
Next question comes from Vivian.
Oh, yeah.
Vivian once more on Facebook,
Yep.
asking how many visits would there be an overnight hospital stay?
No, oh, yeah, sorry, folks, I should have said it. These surgeries are outpatient. There is no hospital. We're not at a hospital. This patient's going to go home in an hour or two after their surgery. We don't keep people in a hospital. There's no hospitalization. This is all done in a surgery center at Deuk Spine Institute. State-of-the-art surgery center. Actually, we have better equipment here than a hospital does.
I would agree with that.
Yeah, there's no doubt about it. We have better equipment. The reason is hospitals, they're really tight on their money. They don't want to buy equipment. We buy the best. If my anesthesiologist comes to me and says, I need this, thingamajig for patients to better care, safer, I buy it. Like literally, Luis will go online, he'll find it within a day and he'll have it here. We don't mess around. We are...
Infusion pumps, the best.
We have everything. Everything you could need for safety is here. All right? Better than a hospital. I worked in the hospitals. I was the chief of staff. I know what hospitals are like. If you want a piece of equipment, even $10,000, you ask, they say, we'll put it through committee. Maybe they'll get it for you in a couple of years. But here, we'll have it for here in a day if we need it. A day. So we have the very best. At a hospital, you're going to have one nurse taking care of you. She's going to be taking care of 5 other patients. Okay? Here, we have 5 nurses taking care of 1 patient. Why? Because we want to make sure our patients get the very best care. Period. And let's face it, the nurses at the hospital are overworked. Okay? And the patient care isn't the best. So we want to make sure our patients get everything they need. So this is outpatient surgery. I got 2 minutes.
I was on staff at 18 outpatient surgery centers in Las Vegas.
Dr. Berndes has worked at 18 outpatient surgery centers
In Las Vegas.
in his past life,
25 years.
and 25 years as an anesthesiologist. He said he's never seen a surgery center
Equipped like
that has as much good equipment as ours. Okay, we have literally the top of the line everything. We want our patients to have the very best results. And that's because of me. I don't want to half-ass anything when it comes to people's spines. That's why I'm so against these other surgeons that are just willy-nilly doing all this invasive surgery with metal and cages that hurt people. It bothers me that they're not giving their patients the best. Yeah, I got 1 minute. We're done. We're pretty much done. This is it. We're done. I don't see anything left. We're done. All right, so type your questions up. I'm going to come answer them for you face to face. All right, type your questions up. I'll answer them for you face to face, but we're done. Oh, look at this here, Henry. See this? You see the little pieces of herniation right here that floated out of the tube? Can you see those?
Yes, we do.
Right? So I'm going to irrigate to get anything else out that needs to come out. And we're going to suck this tube dry. We're going to irrigate a little more. We put in some antibiotic type medicine just to make sure we don't get any infections. Beautiful. And we're done. Let me show you guys, once I take this tube out, what it looks like. Scope use was a 7. All right, so everything comes out, straight out. I'd say blood loss was probably 2 cc's. I'm going to show you folks the incision, okay? For those of you that came late, this is the front of the neck, and there's a tube down her trachea, and we have another tube in her esophagus. Okay? She's from Texas, by the way, Texas. I forgot where in Texas. You guys know? 8 years of neck pain, 25 years of neck pain, real bad in the last 8 years. She was in a car wreck, and you can see all the herniations. Look at the size of this, folks. Jeff, show your buddy 4 millimeters. 4 millimeters. 2 cc's of blood loss. Tell him he needs to just to die and come back as another spine surgeon in his next life, and then he can learn how to do real spine surgery. All right, coming to answer your questions. We're going to put a little Band-Aid on here, folks, a Band-Aid, and she's going to go home in 2 hours. I know her husband's been watching, and I just want you to know everything went great. Couldn't have gone better for her. All right, Henry, let's cut to one of our patients who had the surgery. And good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again, so I did some research. Found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion, though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4 millimeter incision, and we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4 millimeter incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need this surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh yeah, it's
enough
just a little
sun
overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right,
Thank you very much.
congratulations. You're
Thanks,
welcome.
Thanks again.
And good morning, I'm Dr. Artie Majan, CEO and founder of the Deuk Spine Institute. I'm here with a patient who has traveled here to have his neck fixed. He had a herniated disc. We did his surgery just yesterday.
Yes, sir.
It was outpatient, Deuk laser disc repair, endoscopic. How do you feel today?
I'd say probably 90 to 95% better, for sure.
Awesome. And what kind of problems were you having before that brought you here?
Severe balance issues, tingling in my arms and fingers. I had pain running down my leg, but I don't have nearly anything today. So big difference.
And your insurance covered your surgery, is that correct?
Absolutely.
And who do you have to thank for that?
Well, we've got you for one, and your whole staff has been friendly and kind, and you guys have always been on point with everything, getting back to phone calls and emails. It's been a hell of a process. Much appreciated.
You're welcome. And are you taking pain meds now that your surgery is over? A lot of people that have spine surgery, they're on painkillers for months afterwards. Are you on any painkillers?
No, sir, not at all.
None.
No pain enough to need pills.
Awesome. And you can see the small little incision. We went in with a 4mm incision on his neck, and we went through the front, back to the back side of the disc that was herniated, and we used the laser to clean out your herniation and get the pressure off your spinal cord and your nerves. Here you are now. Were you offered other types of surgery besides the laser?
I was a disc replacement of the C4-C5, I believe, and maybe C6. The recovery time was 6 to 8 months of no working, no lifting, none of that stuff. I chose to go with Dr. Deuk just simplistically of, his overall success rate and the transition of being able to get back to work and getting my life back.
Awesome. And you don't have a piece of metal in your neck?
No, sir.
It's all natural. We went in and used a laser to repair the disc, and there's no metal, no plastic, nothing left in his body. You get your natural spine. Anything else you want to say to your fans out there?
Hey, believe in Dr. Deuk and the Deuk Spine Institute.
Awesome. Thank you so much.
Thank you.
All right.
Great testimonial. I still remember that patient today. He did great, and all of our patients do wonderful. Our average amount of neck pain relief that comes from the herniated disc is 99.6%. That is our new numbers based on the last few years of tabulating our patients' data. These patients that have herniated discs in their neck, the reason they have a herniated disc is they've had some type of trauma. Trauma is always the cause of a disc herniation, disc bulge, ruptured disc, bulging disc, slip disc, protruding disc, extruding disc, degenerated disc, spondylitic disc. Okay? Any disc problem, trauma is always the initial event. And the trauma can be remote, meaning back in your childhood. It could have even been birth canal trauma, when the OB-GYN pulled your head, tried to get you out of your mom's birth canal. Point is, or dads nowadays, right? So point is trauma causes a tear in the wall of the disc, and then if you rewind this video, go back, you can see lots of little herniations. Each of those herniations was an event. Another piece of the nucleus squeezing through the tear, becoming a bigger part, a part of a bigger and bigger herniation. So think about a herniation as being not one piece, but a bag of marbles. Some small, some big marbles, and as you drop marbles in the bag gets bigger, bigger, bigger. The herniation gets bigger. So if you look here, you can see a herniation right there, okay? What we're doing is, instead of going through the front and scraping all the disc out to get to the herniation, which is what spine surgeons do today with ACDF, anterior cervical discectomy and fusion, as well as artificial disc, total disc replacement. They're going through the front, they're scraping your whole disc out, they're trying to get the piece in the back, or a lot of times they just leave it in the back and they put a metal plate and fuse. And boy, those surgeries, they pay a lot of money. So they make a ton of money making these surgeries. The companies that make this little piece of metal, you think they get paid $10 for that, that's all it's worth. They get paid $1,000 for that plate, okay? And the screws are about 400 bucks a piece. So you're looking at, on average, between $5,000–10,000 in implants, metal, cages, bone graft, per spinal fusion. Now, if you multiply $10,000 per spinal fusion or artificial disc times 2 million procedures in the United States done every year, I don't know what that number is, but it's a big number.
Yeah.
Bigger than my pay scale. So that's probably like 20 billion or 200 billion, I don't know.
Something like that, yeah.
But that's how much these companies make off of spinal implants. So it's big business. Well, the Koreans, Dr. Sang-Ho Lee figured out, you know, if the problem is the herniation in the back, why don't we just go through the disc with a little tube and get to the part in the back and use grabbers to pull it out. And that's what he did. He developed what's called the percutaneous cervical transdiscal approach, and I learned it directly from Dr. Sang-Ho Lee. He's the founder of Woodidal Hospital in Korea. He taught me about 18 years ago. He probably doesn't even remember me, all right? But he taught a bunch of people, probably. Anyway, long story short, I took his technique of putting a tube in and using the endoscope, and I added the laser, because the laser is the key to removing all the herniation. You can't get all the herniation without the laser. If you use regular surgical instruments, you can't get it. So the laser being added, it's called the Deuk laser disc repair. We're the first to do it. We're the first to pioneer it. It is named after me and my company. This is where you come to get it done. So we just went through this lady's disc, 2 of them, and to the back where the herniation is, and I used the laser to remove it from the inside. Now, when I was done, I took my tube out, I went onto the bone, and I slid up to the next disc, and we poked in. That's called the Deuk spine slide, or shuffle. All right, we'll take questions.
No current questions, but we do have a comment that comes from Vivian once more on Facebook.
Oh, Vivian, that's right.
Yep.
When can you get your surgery done? We can do it next week if you want, but you gotta get your MRI review done ASAP. If you really want to get your MRI review done ASAP, call 321-775-1299. 321-775-1299. Ask for Sam. And you're going to have to fill out the form on the MRI review form site. That's mri.deukspine.com. Type that in, fill out the form, and send us overnight your MRIs, CDs. And then you do that through FedEx or UPS. Once we have it, we'll do a Zoom call tomorrow afternoon if you want, and I will make a recommendation for what needs to be done, how many discs, how many sides, and maybe you don't even need surgery. Maybe you need something else done. But we'll figure out where you're having pain and why you're having your symptoms, and we can have you here next week to get it fixed. All right? So that's true for anybody, by the way. It's not just true for Vivian, it's true for any human being or animal. Though I haven't tried animals yet, I've tried humans, that's it. Well, we might be able to do an animal, all right? I almost thought my Dachshund had a herniated disc the other day. He stopped moving his legs, and that's the wiener dogs, if you don't know. He stopped moving his back legs, and I thought, oh my God, he's got a herniated disc, I gotta do emergency surgery. But it turned out he was sick, and he was vomiting. He must have eaten something bad, and then he just didn't move his legs while he was vomiting. It was very weird. But it was sort of a brain thing, and then his legs worked fine. And if you don't know what I'm talking about, go look at Scooby on my Facebook page. You'll see Scooby. That's my little dog. Anyway, thanks for joining us. Our next surgery is a lumbar 2-level, L23, L34, right approach, endoscopic, transforaminal, inside-out technique. And she's also going to get the Deuk plasma rhizotomy for her facet pain. So we're fixing the discs with the laser, we're fixing the facets that are causing her pain with the plasma. Hope you enjoyed surgery, and Jeff Deverett, make sure your friend sees this video. Hello there, I'm Dr. Deuk Major, nice to meet you, and I could tell you a little bit about myself when I meet you.